Something that confuses a lot of people that follow me, as well as many providers and especially medical students, is the Gleason score, which is basically a grading system for prostate cancer. Prostate cancer is essentially an uncontrolled proliferation of prostate glandular cells. This can cause problems because uncontrolled growth can locally invade and destroy the prostate. It can also invade and impinge on the urethra, or it could metastasize and spread to other parts of the body. When you're trying to diagnose prostate cancer, one of the things that you want to do is you want to biopsy the prostate. A biopsy is when you take a small sample of something so that you can examine it closely under a microscope and look for any abnormalities. Here we're looking at a cross-section that shows us the inside of a person. Here we see the bladder, this is the prostate down here, and back here is the rectum. What this image is showing is an ultrasound-guided transrectal biopsy of the prostate. Right here is an ultrasound probe, and what that probe is doing is it's shooting sound waves in real time up against the prostate. That way the urologist can see what he or she is doing. Using the images from the ultrasound probe, the urologist will use a needle to grab little tiny samples in different areas of the prostate. Typically, a urologist might try to get 12 different samples in 12 different areas of the prostate using the needle. These tiny pieces of prostate tissue are then sent to a pathologist, and then they'll prep the sample and put it under a microscope, and it might look something like this. I know this looks like a big crazy blue mess, but try to stay with me for a second. So notice we have medium to large size glands, right? So we see all these different glandular tissue lined with epithelial cells. Note that they're tightly packed. They appear relatively well organized. We can see that down here too. This is a little bit more zoomed in. This is considered normal and would be dubbed a Gleason pattern 1 to 3. On the other hand, this would be considered a Gleason pattern 5. So note, we don't see those nice glands anymore. We just completely lost that nice glandular architecture. There's complete uncontrolled proliferation of these little tiny epithelial cells. You can see their nuclei, which are stained dark purple, completely loss of the organization, and this would be considered basically prostate cancer tissue. So a higher Gleason pattern is considered more abnormal. This is a nice little image from Amboss. I'm not sponsored, unfortunately, but I still think they're great. And what they do is the two most common Gleason patterns within any given sample are added together to get a Gleason score. So if you have a 5 and a 4, for instance, that would be a Gleason score of 9. And then based on the Gleason score, you get a Gleason grade group. Higher Gleason grade group usually means more severe cancer and is used with other factors to help come up with treatment plans and risk stratify.